Sorry. Good morning, everyone. Thank you so much for joining us today. It's wonderful, especially after COVID and during COVID, to have everyone here participating. We do appreciate your time, and I'm very excited to be sharing this session. My name is Irene Mbari-Kirika. I'm the founder and executive director of inAble. inAble is a nonprofit that focuses on empowering the blind and visually impaired in Africa through technology and promoting digital accessibility. So I'm very excited to have two ladies next to me, and we have one more lady online. They're going to share what they're doing in terms of innovation. One thing I keep saying all the time is that the beauty of Africa is that some of our challenges are very unique to the rest of the world, simply because of where we are economically, the landscape, our geographic location. So when it comes to disability or accessibility, it's always exciting to sort of adapt what has already been developed by other countries. But at some point, we also have to come up with some solutions for some of our very pressing challenges. So to kick off this session on innovations, I'm going to start off with Doreen, who's from Zambia. So I'm taking you all the way to Zambia for Doreen to share what World Vision is doing when it comes to sanitation and mapping out healthcare facilities in Zambia. So over to you, Doreen.
Hello, everyone. My name is Doreen Chizyuka. I'm from World Vision Zambia. And I'm going to be talking on the GIS mapping that we are carrying out as World Vision in order to make sanitation facilities and water points accessible to persons with disabilities. So I'll start by giving you a brief background of World Vision Zambia. It is an organization which is Christian, mainly dealing in humanitarian aid, relief, justice seeking, and also we are into the business of just ensuring that people that we are saving, together with their communities, have life in its fullness. So the WASH project is doing mapping of water facilities together with sanitation facilities using the geographical information system on the M-Water portal in order to make sanitation facilities accessible to persons with disabilities, especially in the areas where they are needed most. The M-Portal is basically used mainly to map healthcare facilities and other institutions such as schools. So the M-Water portal is an open source platform which is used to manage information with regards to water tasting and also just to be sure where the water point is situated. This is a platform that is used by governments, NGOs, and water utilities companies. So what I'm showing you now is basically a map of Zambia as a nation, and the areas that are dotted orange are the areas where World Vision Zambia operates. These areas are further divided into sizable portions which are called wards for easy management, and it's within these wards that World Vision is doing the mapping of facilities. What you're seeing is just an example of what it looks like after the mapping has been done. So we have a clinic there, a health facility in an area called Moyo Hamaundu in the southern region of Zambia. Once it's mapped on the portal, that's how it appears. You will have information which is giving you the exact location of a water point or a health facility. It is going to show you whether the health facility water supply is piped or it's just a hand pump. For further information on the same, anyone can actually access it on the website. What we have there is just to show what the innovation I'm talking about is. Why the innovation? The mapping of the water point and facilities that sanitation we are doing just gives us the location. We are able to know where a water point is. We are able to know what type it is. And so to go further, we thought of innovating a way that we are going to be able to actually see how accessible a particular facility is. So in the picture on the far right, we see a World Vision staff taking information from a person with disability at the household level. Because remember when we started, it is just mapping at institutional facilities such as healthcare and schools. But as World Vision Zambia, we thought of a better way that we could have persons with disability access facilities without any challenges. And so we went ahead to start mapping facilities at household level. And so a person who is trained as a staff goes out in the field to get information and just engage a one-on-one with a person with disability to try and understand what barriers they face with regards to access. We see on the far left a person accessing a facility with a lot of compromise. We can easily see that the wheelchair cannot be it cannot access the facility. It is left on the door, which compromises the privacy of a person and, in fact, the dignity of the person accessing the facility. So the main aim of our innovation was to better the quality of the facility and the life of a beneficiary. So what impact has this innovation had? We see that at the end of the day, after engaging with people with disabilities at household level, we get to have reliable and profiled data about the person. Once this information is had, it gives us an idea of where a person is, what type of facility they have, and whether or not they're able to access it. I must mention also that when we are getting information from these people, we do not use their actual names. We code the names for privacy purposes. We also get to have barriers that they face known and understood by the staff of World Vision who are out there in the field. Once they know what barriers a particular person faces, it is then easy for World Vision to assist in the construction or just to give an idea on how best the construction of a particular facility, especially the sanitation, will be for that person to access. We also get to have improved access of the facility by the beneficiary. Further, I'm trying to just share the result of what we have done. You see, comparing from the earlier slide and to this current slide, there's an improvement in the structure of the facility. The accessibility is made easy. We also get to get higher quality of the type of facility. In that facility on the right, you see that a person can easily access with whatever assistive device they are using. There's a lot of room to maneuver while in there, and there's also some comfort and privacy. Another impact is that the data that is collected is used to influence other programs within World Vision Zambia. I used an example of the education project. Once we collect data, this data is used by World Vision and other stakeholders that we work with, for example, the Ministry of Education. And the data can actually direct us, together with the profiles that we put together, to know how many children in that particular community are eligible to be enrolled in school. Children with disabilities in the rural parts of Zambia where we work usually will not go to school because of access to facilities. The design of the mainstream services sometimes do not consider disability. And so when we collect such kind of data, it's which data influences how the design for particular infrastructure is going to be based on the profile of disability in a particular area. For the health program, we also go further to find out a life that the particular beneficiary is leading if they have any condition that the health program will be able to respond to. Also, we have a program in the livelihood sector we get to use the same data to be able to determine what sort of empowerment program can be undertaken in a particular area. So who finances, or what is the financing of this innovation? This innovation is supported by the World Vision Zambia WASH program together with its donors. So people come on board to finance the program, and I must preempt and say, for a complete household package, we have experienced that it can cost to as much as $7,500 in order to be able to put up an accessible infrastructure, an infrastructure which is a little bit modernized, because the package I'm talking about actually does not just consist of the sanitation facility. We also get to further provide water. What are the challenges that we have faced in trying to do this innovation? As I mentioned, we are working in the rural areas of Zambia. So some locations become very difficult to access due to poor road network. And as we speak, in Zambia, it's rainy season, so some areas get totally cut off, meaning at a certain time of the year, our program gets told to wait for the rains to end and the roads to get a little bit dry for vehicles to be able to pass through. Another challenge is that sometimes we get resistance from persons with disabilities because of their expectation. Oftentimes, they expect to receive something when you approach them, because in the past, persons with disabilities have been deemed to be on the receiving end. But if you go to just discuss development with them, take them as a development partner, they tend to resist because you are not meeting their expectation. We also have myths in some areas of Zambia with regards to disability. Some example I might give is where people believe that for a person to be disabled, something not right must have happened. Some of them might think a particular couple could have practiced some rituals in order to get wealthy, for example. Some of them, for albinism, might take it that they were trying to get a part of a child in order to be wealthy, and many other myths. And so when a person from a development organization approaches them, that's what comes to mind, and they will resist. There's also just general stigma within the communities. They look down on people with disabilities, and even people with disabilities themselves shy away from being engaged or going out to take part in community activities. What's the sustainability of the innovation? As I mentioned, the portal is an open portal which is accessible by any person. And so as World Vision, we have gone further to train our stakeholders, our partners, on how to access it, on how to collect data, to a point that if World Vision left a particular community, any other stakeholder working in that particular community can carry on with the uploading of data, updating, and sharing it with the government. And our next step, because Zambia was piloting it, we hope to share the innovation and roll it out to many other countries that World Vision has presence in. So for further information on what the portal looks like, how it operates, what water information you can find, I have put references there. You can check the M-Water, the World Vision web, and information shall be reached there. Thank you.
Doreen, thank you so much for sharing the information about your program. And I'm sitting here and thinking, having grown up in Kenya, and I do make frequent trips, the one thing that happens in one of our programs, we actually have a pit latrine. And I'm thinking that 80% of Africans live in rural areas. And at the same time, the main mode of course, there's the whole sanitation, But when I think about the pit latrine, it's very common in every household. And I'm asking myself, oh my goodness, how have people with disabilities really survived using pit latrines? So I'm wondering, and this is a question you can answer later, is how do you make it affordable and scale? Because this is something that's desperately needed to be able to support people with disabilities. You can go ahead.
Thank you, Irene. So what we do is to get people in the areas where we work, make use of local materials. As she rightly mentioned, across Africa, really, pit latrines is a form of sanitation facility that we have used. And so what we get to do is, in such a case, we get a person with disability help us to design what will be suitable for them. They use the same bricks made out of clay soil to make a sitter, which is accessible to them based on the specific kind of disability.
We'll definitely you with additional questions from the audience. Time, I think we'll go to East Africa and we'll speak to Nicole, and she'll tell us how they're using recycled plastics to make a difference to people with disabilities in the continent. Thank you.
Thank you very much. Does this work? Yes. So, good morning, everyone. I am Nicole. I'm one of the co-founders of Project Circleg, here with Laura, sitting in the audience, and an amazing team that is split between Zurich and Nairobi. Project Circleg is a social enterprise. Among many other activities, which I'll now briefly describe, we develop high-quality lower limb prosthetics for low and middle-income countries. So, why Circleg? What brought us here? 80% of the world's amputees live in low to middle-income countries. Out of these 80%, less than 10% actually have access to prosthetics. This is due to a series of different reasons. Of course, affordability is the main problem. The great majority of existing prosthetics are just extremely expensive, which makes them unaffordable for the great majority of amputees. This is also due to the fact that they are not local. They are usually manufactured in high-income countries. They need to be imported from afar. Usually the importing is very costly, it's very ineffective, it's very complex. And this ultimately results in long waiting lines, and of course in just generally less accessibility for amputees. On the other hand, like it was just beautifully explained, there's a huge stigma around disability and of course also about amputees. Amputees are like self-isolate themselves, and they're also not aware of the resources available to them, right? The main causes of amputation are accidents and diabetes, but mostly accidents in East Africa where we operate. It's something that happens all of a sudden, so people find themselves just completely lost and completely unaware of the resources available to them. So we tackle this problem and these complex problems through a holistic approach, which we believe is also very important to apply in finding solutions to such issues. So on one hand, we think it's important to, of course, develop a high-quality prosthetic, but it's also important that this prosthetic is produced locally and it's produced sustainably in harmony with the planet. On the other hand, we also think it's very important that amputees can actually access the prosthetic, both financially and geographically. So now I'll go a bit deeper into our holistic approach. So here you can see one of the main ways in which we provide high-quality prosthetic care, which is through our Circleg prosthetic. There it's in bright blue because it's available in different colors. It's a fully mechanical system. It's modular, it's customizable, also depending on the type of amputation, whether above knee or below knee. It's adaptable to different weights, sizes, activity levels of amputees, and it can also be adjusted according to amputees' aesthetic preferences, right? Would they want a bright blue? Would they prefer skin color? Would they like it red? Most importantly, this prosthetic was developed in close collaboration with our beneficiaries, so both amputees and orthopedic technologists in East Africa. This is also why the prosthetic itself is very easy to repair, to maintain, to fix. Workshops in the area do not need to purchase any additional supply in order to work with this technology. But of course, it's still a new product. The prosthetic market is quite, let's say, traditional. So we also believe to provide high-quality prosthetic care, it's important to provide training along with the prosthetic to make sure that the specialists really possess the required knowledge to fit and repair and provide amputees with the best care that they deserve. What is also unique about our prosthetic is that it's local and it's sustainable. It's local because, like what I mentioned before, we will manufacture it in Kenya, specifically in Nairobi. And it's sustainable because it's made of recycled plastic and it's manufactured following circular economy model. So here you can see what we call the Circleg cycle. So what we do is through partners, we collect discarded plastic, in particular polypropylene. This is then recycled and used to manufacture the prosthetic, which is then distributed to prosthetic and orthotic centers around the region. Then, of course, I mean, eventually components of prosthetics over the years, I mean, we try and delay this process as much as possible, but prosthetic is not forever. So components deteriorate. Normally, this would end up in landfills or be just discarded. But what we do is we collect these discarded components, not only from the Circleg prosthetic, but also other components that lay in prosthetic centers, and then we reinsert them into the production cycle to then be used to manufacture new prosthetic. What's also important for us is for this model to be scalable. So what I just described happens in what we call the Circleg East African Hub, which we're establishing now in Nairobi. But we want this hub to be the first, but not the last. So our vision is to then develop different hubs because the need is global and widespread, and we're already receiving a lot of requests from whether Latin America and Asia and so on. So we believe it's, that this hub model is to be very scalable and able to support amputees around the world. Another important aspect, like I mentioned before, is accessibility. We're fully aware that even the Circleg prosthetic is still not affordable for many amputees. So we want to find solutions to this problem. This is why we are investigating, for example, the option of providing microloans in partnership with different institutions, or we're setting up partnerships with NGOs and corporations, governments, to make sure that more amputees can access the prosthesis financially. Geographic accessibility is also, of course, a topic. I mean, the majority of the African population does live in rural areas, and the majority of orthopedic centers are in urban areas. So, which is also why it's important for us that the prosthesis can be fit, for example, through a mobile hub concept, and it's able to reach even remote regions, which is often where, I mean, the majority of amputees actually reside. On the other hand, we also think that the prosthetic alone is not enough. That there's usually, that there's an overall lack of resources and that amputees should have access to, which is why, for example, we collaborate with amazing amputees, amputee empowerment associations, for example, in Uganda, and so that are doing amazing work, and we want to co-develop programs to empower amputees even more, to give them access to all sorts of resources, from training to community to therapy. I mean, just to provide them with all the different tools and the healthy ecosystem besides the prosthetic to really ensure that they happily, let's say, reintegrate into society. We also develop communication campaigns. Here you can see an image from our Be Bold campaign, where some great bold amputees collaborate and kind of showcase their bold actions. And yes, this would not be possible without the support of amputees. So here actually we have Lawrence and Ali, which are two amputees which supported us in Uganda last year during the user testing, providing great feedback. Luckily the feedback was really positive, which made us really happy. And but it's really important for us, you know, to work closely on the ground with people constantly, also with this feedback loop. And actually what we're doing at this very moment where we stand is we are integrating the feedback of amputees and orthopedic technologists that we collected during our last user testing last year. We're currently entering what we call the industrialization phase. So we're finalizing the prosthetic, fine-tuning the last details, implementing the feedback I just mentioned. We are certifying the prosthetic because we think it's important that the prosthetic is high quality, respects ISO standards and so on. We are setting up the East African hub, and then we plan to begin production and distribution at the end of 2023. Since we haven't not begun distribution yet, we're currently fully financed via grants, thanks to the support of a series of great supportive foundations that have been supporting this journey until now. But of course, in terms of sustainability and scalability, our objective is to become financially self-sustainable. So in the medium term, we plan to finance our operations through the sale of prosthetics and of our services right now. And yeah. Freedom of mobility for everyone is our vision. It's an ambitious one. Here you can see another image, my personal favorite from our Be Bold campaign with Lawrence, Charlie, and Alex. They are 3 great amputees. They are members of the Amputee Self-Help Network in Uganda. They've been doing amazing work supporting amputees and also supporting us through amputee empowerment campaigns and co-developing them together, and also starting to act as Circleg ambassadors. So we're really happy and grateful to have such amazing people in our team, and also that believe in what we're doing. And yes, I mean, this was Circleg in a nutshell, what we do. There's a lot more, but time is short, so Laura and I will be at the conference over the next 3 days, so feel free to stop us by if you'd like to know more. Thank you.
Thank you, Nicole. You can definitely tell from her passion, her energy, that this is a transformative project, so we do appreciate your presentation. And what's interesting is you mentioned that one of the main causes for amputees is really road accidents. And if you've lived in Africa, or if you know anything about Africa, major road construction, modern roads are very new. Superhighways are very, very new. So most Africans, in most parts of the country, you find it's very rural and the roads are not as advanced. But what's happened over time with the advancements that are coming with new roads, in my opinion, from my experience, I was in Kenya a week ago, and this is a conversation we were having, is that most drivers are not used to superhighways, and they sometimes underestimate the danger and the speed and what comes with this particular type of superhighway that now most countries are exposed to. So you find even in countries like Kenya, road accidents are so common, but they can actually be avoided if maybe there was more education and just people getting a true understanding of what are these roads about. It's not the same one like the dusty road you were used to, where it took you some time to drive. Now you're going 80 miles an hour within a very short time. So thank you so much, Nicole. The one thing that will be that has been interesting to hear from you is recycling. That's huge. Using of local materials. That's very, very important. We don't want everything imported, and we have a lot of plastics in Africa, so that's very exciting. And then the power of collaboration. You talked a lot about collaboration with the local people who are benefiting from this product. And I think the one area that would be interesting to hear more about later on is really the cost and affordability, because bottom line is, if we're going to come up with solutions for people with disabilities in Africa, we need to address the issue of cost. There's a huge majority who are not employed. Africa, most countries are low income, so we need to make sure that the innovations are affordable. They may not be affordable now, but maybe long term, there could be a plan of how we can make sure these amazing solutions can be integrated into the African communities. So thank you so much for the presentation.
Thank you.
Yes. Next, we'll go to Ethiopia, and I'm going to invite Srilakshmi to join us, and she's going to talk about the Meet platform. As we know, during the COVID season, a lot of people with disabilities did not have access to information. So with this project, she's going to explain to us how mobile phone-based information service has helped people with disabilities in Ethiopia, especially through the local language that most people in Ethiopia understand. So thank you so much and welcome.
Thanks, Irene. A very good afternoon to all the distinguished guests, speakers, and the Zero Project team. I'm Srilakshmi from Ethiopia, representing the Ethiopian Center for Disability and Development. We thank the Zero Project team for awarding us and recognizing our innovation. It's truly an honor. Can we just move to the next slide? The ECDD, or the Ethiopian Center for Disability and Development, is an Ethiopian civil society development organization established in 2005. ECDD works with other organizations to promote and facilitate the inclusion of persons with disabilities and their issues in mainstream service delivery and development programs in Ethiopia. Can we move to the next slide? Let us now hear a message from the ECDD Executive Director, Dr. Gita Hon. Please move to the next slide. Hi, can you hear me? Okay, great. Could you play the video, please?
Distinguished guests, conference participants, ladies and gentlemen. First of all, I would, on behalf of Ethiopian Center for Disability and Development, I would like to express my deepest gratitude for the award given by the Zero Project to the innovative mobile-based IVR technology called Mint that provides disability-specific information on health, education, livelihood, employment, and other services or opportunities to persons with disabilities. ECDD believes that technology and innovation is a key equalizer that provides inclusion and full participation of persons with disabilities in all sectors and dimensions of life. It is with this understanding that ECDD implemented mobile-based interactive voice response system serving as a toll-free source of information to persons with disabilities. The platform was launched in February 2021 with partnership of 5 entities. ECDD as a lead partner, inAble India as a knowledge partner, Gramvani Onion Dev as technology partner, EthioJobs.net as employment content provider, and Ethio Telecom as a telecom partner. We envision that this technology will become more accessible and usable by persons with disabilities through embedding multimedia features and artificial intelligence capabilities. Thank you so much.
Can we move to the next slide?
So
what is Minch? Minch is an innovative social networking platform that helps to bridge the information gap for persons with disabilities. And this does not require a smartphone or the internet. All users have to do is to call a toll-free number and listen to information, provide feedback. They can share their experiences with each other and also engage with ECDD through surveys and discussion groups. Minch is free for the end user, and since its launch, it's soon evolving from an informative social media platform into a powerful advocacy tool for persons with disabilities to voice their concerns and hold the government of Ethiopia responsible for delivery of services to persons with disabilities. And Minch users communicate in Amharic, which is the most widely spoken language in Ethiopia. And the fact that this does not require the internet for use is perhaps its most innovative aspect, especially given how challenging it is to connect to the internet in rural Ethiopia, which is the single biggest barrier currently that blocks information flow for not just persons with disabilities, but even for the rest of the population. Can we move to the next slide? So what has been the impact so far of Minch? We've received more than 87,700 calls since its launch, with an average call duration of 3.5 minutes. We have about 22,689 callers registered on the platform so far, approximately 7,300 calls every month, and users request various types of information. And a breakdown of this information can be broadly classified under work and employment, vocational skills training, general disability information, updates and upcoming events shared with Minch, which is a feedback channel, education-related information, and health-related information. And the percentages that you can see on your screen shows the user engagement under all of these topics. It is to be noted here that the user engagement data, it varies from month to month. And these statistics showcase the system's capability to generate detailed insights to better understand user behavior. And it also helps us to customize our content accordingly. Can we move to the next slide? We also receive users and their feedback, such as positive feedback. We've received 116 about the Minch platform experience. We receive requests for legal aid, for requests for protection against discrimination based on disability at the workplace and lack of reasonable adjustments, requests for information on accessible and inclusive schools nearby, requests for clinical explanation of health issues which would result in disabilities such as eye diseases and neglected tropical diseases, and requests for additional inspirational stories of other persons with disabilities in Ethiopia. Can we move to the next slide? Here are some anecdotes shared by some of our Minch users, such as Mr. Negosi from Adama region. He says the start is good. Next time, please ask government stakeholders about persons with disabilities and present to us their work on a regular basis. And we have an unnamed user from the Amhara region who says Minch answers many questions and is a voice for many persons with disabilities. We are witness to how long we have been asking for such a platform. We did not have such a platform to express our ideas and questions, though. I would like to thank Minch who solved this problem. It would be better if you advertised on radio and TV and made it accessible to more persons with disabilities. And Mr. Melkit says, thank you so much for starting the Minch One-Stop Information Center, and I would like you to start in another Ethiopian local language. Can we move to the next slide? What about the financing? So currently, Minch is being financed by the United Nations Population Fund, UNFPA, and we will continue to seek extension of our 3-year contract with them. Challenges for us mostly remain with long-term funding. ECDD is exploring support from the private sector through corporate social responsibility grants. Currently, Minch is partially supported by Ethio Telecom, which is the only telecom company in Ethiopia through its CSR program. We receive a 50% discount on call and data tariffs. So to move to the next slide, what are we currently working on? The next steps, firstly, would be to develop a mobile app customized to the needs of persons with disabilities in Ethiopia. We understand that since this is a voice-based innovation and a solution, we want something for persons with hearing impaired too, and that's why we're working on the mobile-based app. The next is to build artificial intelligence for research and work towards making the MINT system highly intelligent and automatic towards responding to user queries and reduce our human intervention. We also want to add more regional languages such as Oromifa just to get more reach into the other regions of Ethiopia. We want to create a recruitment team specifically to support callers who are seeking job-related information. And we also want to generate income through Minch by promoting it as a platform for advertisements and to also allow other organizations to hire our platform to reach out to persons with disabilities. So just moving to the next slide, in order to build these additional features and an increase in the number of calls means an increase in cost for ECDD too, since the platform is free for the end user. Therefore, we request the donor community present here to partner with us to realize the full potential of Minch, not just in Ethiopia, but to replicate in other African nations as well, where a solution such as Minch is most urgently required. We believe that persons with disabilities in Africa are not only fighting for inclusion, but they're also fighting the diseases that cause it, such as neglected tropical diseases like leprosy that continue to be one of the lead factors for grade 2 disability. Just to give you an idea of how long it takes to bring about change in Africa, I would like to share the backstory of Minch. We went with the idea of Minch almost 4 years back to start that in Ethiopia. And by the time we secured funding, by the time we figured out the technology solutions to make that happen in Ethiopia, and we hired an Indian telecom technology company to bring in the technology from India to Ethiopia. And by the time we figured all of these things, it took us almost 3 years. And ironically, by the time things started moving on the ground, I was implementing this project and I was expecting my first child. Great timing, huh? So, finally, when things happened and things started to move, we had to move ahead with all of these roadblocks. And it took us almost 3.5 years to make this happen. And today, when we look at Minch and looking at the thousands of users that are using Minch, we feel nothing but gratitude and we feel real happiness. And we therefore like to request everyone present here to make Africa your priority, because persons with disabilities here need support probably more than anywhere else in the world right now. Thanks again, Zero Project team, for this award. We're truly honored. Thank you. Namaste. I can't hear you, Irene, sorry.
Sorry, can you hear me now?
Yeah.
Thank you.
Okay.
Thank you so much for your presentation. And as I said, some challenges are unique to Africa. And in this case, I'm sitting here and thinking that advancements in technology are just creating the best opportunities for your product, sort of endless opportunities for you to be able to scale. And I'm wondering, how do you find a balance between creating a more advanced product, because it's very, very useful and it needs to reach millions of people, and then also making sure that you don't alienate some of your users, because in Africa, most people use feature phones. So having apps and all that might not work. So how do you find a balance in that space, considering that more than 80 million people with disabilities live in Africa?
Thank you, Irene. As I mentioned, since this is a voice-based technology, we're looking to firstly develop the app for those who do have a smartphone, but for those who do not have, especially the hearing impaired community, we've built in an SMS feature. So what happens is when there is new content being uploaded on the system, the users get an alert that there is a particular content under work and employment or under health initiatives. And what they can do, the entire content, however, is not available through SMS, but what they would then need to do is to probably request a family member, maybe to listen to the content and translate to them. But just to overcome this, the only option for us is to create the mobile-based app.
Okay, thank you so much. Let me open up to the people on the floor to be able to ask questions. Can we take a question, please? Yes, please, go ahead.
Yeah, Edward Winter from World Vision. Just wanted to ask a question to ECDD about, it seemed as though a lot of people were using the interactive voice response to provide feedback. If you could just say a little bit more about what they were providing feedback on and how that happened, that would be really interesting. Thank you.
Thank you. So our users provide feedback on multiple topics, as I already mentioned. A lot of them request for legal aid. A lot of them share stories about discrimination at the workplace or even otherwise. A lot of them want us to convey messages to the government about the work that they're doing and in a way to receive information from the government as well. So they want us to post such information too. Other responses that we get usually is mostly just positive feedback about how great it is to use such a platform and how it's been missing for so long. And in fact, we've got such a great response from our users that the ministry here, which is responsible for disability development, they want to adopt this as a long-term sort of a goal, and which is something we're still discussing with them.
Thank you so much. Can we take another question, please?
Christian Hofer from Ottobock. A question to Project Circleg. Where is it? Okay. Since the prosthetic device itself is one component of this fitting of a patient, the socket is the other one, which is quite essential. And as you know, all the mechanical stability, you have to transmit the forces into the body, to the prosthesis and so on. Did you consider that also? Is this also made of this recyclable material? And the second thing is regarding the regulatory framework. Is it also considered in Africa? Because we're talking about industrialization, this comes into play too, I think.
Thank you very much for the question. Well, regarding the socket, we do not provide a socket. So we only focus on the prosthetic. We provide the knee, the pylon, the foot, and the cover. So no, we work with our system is compatible with existing sockets. There's standard adapters. We're watching very closely because there's also movement currently happening regards to innovation in the socket world. The problem is our product is meant to be industrialized and produced on a mass scale, and a socket needs to be, as you know, customized, right? Because everyone's leg and amputation is individual. So no, current users of the prosthetic, of the Circleg prosthetic, will just be using any standard socket available. And yes, I mean, with regards to the regulatory framework, we're currently actually looking at that right now, but we see, I mean, this was actually integrated at the early stage of our development phase, so we don't think that that's going to be a limitation for the regulatory framework in East Africa for us to manufacture the prosthetic and sell it successfully in the area.
All right. Yes, please.
Yes, I'm Khalil from World Vision, Iraq. My question would be for my colleague Doreen from World Vision, Zambia. In the context of Zambia, to what extent do you have chance to partner with local disability organizations and to involve them during the design of the accessible wash facilities to ensure sustainability of our intervention?
Thank you. We are partnering with them. What happens is as Zambia, there is a forum for a working group. So it's in these meetings that we share ideas and we bring every other person on board.
Thank you.
Hey, this is Oliver from CBM. I have another question to Doreen about your WASH project. I understand from what you said that the project addresses very much the physical accessibility of the WASH facilities, but you also mentioned about the attitudinal barriers, like the stigma that people with albinism face. So just wondering to which extent is also these, let's say, invisible barriers addressed by your project? Because we often see in our work that this might be even the more complicated barriers to make people, for example, use public WASH facilities. So is this also somehow addressed in your work? And if yes, how? Because this is always interesting to learn.
Thank you. You're very right. These disabilities that are not visible, usually, especially in the areas where we work, because people don't want to talk about it. But we have deliberately created platforms where we share messages that attract people to come and hear, to come and listen to what we are doing, and those that are willing come on board.
Yes, please go ahead.
Yes, hello, I'm Chris from the Asterix Foundation. My question would be also in the topic of sustainability of the solutions, and if there is a recommendation of you, which partners we could try to reach out to implement local cooperations. We build, for example, open source hardware for people with disabilities, but it's very hard for us to find local contacts which are reliable and that we can implement cooperations which are sustainable so that people are also trained and can establish a local manufacturing of these tools.
Sorry, could you repeat your question again?
The question is, do you have recommendations to reach out for local partners or organizations who can help in implementing local partnerships?
Yes, definitely. Coming from Africa, most of us, we have contacts. So what we can do, we can talk after this to understand the scope of your project so that then we know the best recommendation to make. But definitely, Africans are willing and ready to partner, especially to localize the products. Thank you. We have 30 seconds. Anyone else? Excellent. So I want to say thank you so much to our amazing speakers for your time, for sharing the knowledge about your products, and to welcome you again when you have a moment to please speak to them to learn more about their, the projects they are implementing. And also for you, for your time, for joining us today. Thank you so much, and have a wonderful Zero Project Week. Thank you.
Thank you.